I really want to challenge the assumption of some of the amendments in this group that what we need is more dedicated mental health practices or provisions in schools. I feel myself that one of the problems that we've got is that there's too much emphasis of mental illness, mental health in education at the moment, and that actually awareness is taking up too much time of school life and is over preoccupying young people, and it's basically becoming a real problem. If you actually look at what's going on in schools at the moment, there are indeed endless numbers of staff and volunteers and organisations with responsibility for emotional well-being. Mental health leads, support teams, emotional literacy, support assistants, mental health first aiders, counsellors, well-being officers. If you go into any school, the walls are covered in more information about mental illness, mental health and so on everywhere you go. Yet despite this booming school-based, almost mental health industrial complex, the well-being of pupils continues to deteriorate, or that's what we're told. Mental health problems and diagnosis is rising at the same time as all the awareness initiatives are taking place, which I think at least needs some investigation. I sometimes think that, the thing about something going wrong is what I would like us to investigate, but it seems to me that these amendments just assume that we should carry on doing the same and more of the same. And as with the noble Baroness Spielman, I actually do think that there are real critical thinking needs to be done around some of the awareness campaigns. So I do want to challenge the idea that schools are actually the vehicle for tackling the undoubted spiralling crisis of unhappiness amongst young people. And I also think it's important that we untangle that from the crisis of CAMHS. There is actually a serious problem of mental health support for children in terms of the NHS, and I would like that to be taken on. That is very different to the kind of discussion that we're having here about schools, which is that mental distress becomes such a focus of all the discussions in schools. I tend to agree with Tony Blair on this, possibly the only time, when he said, you've got to be careful about encouraging people to think they've got some sort of condition rather than simply confronting the challenges of life. And I do think that's true, and I think starting with children, we are encouraging the young to internalise the narrative of medicalised and pathologised explanations and the psychological vocabulary in terms of adopting an identity of mental fragility that is not doing them any good. And I think that can then create an increasing cohort of young people and their parents demanding official diagnosis, more intervention, more support at school. Dr. Alistair Santas, a neuropsychiatrist at the Maudsley, in his new book, No More Normal, Mental Health in an Age of Overdiagnosis, argues this. He says, it's become crucial to reassess what constitutes mental illness so that we can decide who needs to be treated with limited resources and who can be helped in other ways. And he's talking there about the NHS. But he warns that the NHS is buckled under a tsunami of referrals, and he then, for some conditions, and he then says other state services, such as schools, are straining to the point of dysfunction in relation to this particular issue, and I tend to agree with him. So whereas I admired the passionate intervention by the noble Lord O'Donnell in terms of a call for measurement and evidence, one of the problems is I'm not entirely sure that we know what we're measuring. There's actually no clear definition of well-being to be measured. The psychiatric profession are making the point about the definitions of what constitutes mental illness are now contended. There is arguments about them. What are you measuring? And this woolliness of definitions, I think, is becoming a problem in schools. The Councillor Lucy Binney, in her excellent recent pamphlet, worries that this means that mental illness in schools is leading to a kind of diagnostic inflation itself as pupils kind of compare notes on what they've got and go to different professionals to ask what they've got and so on and so forth. And it can, I think, create a sort of social or cultural contagion, enticing the young to see all their ups and downs of life through the prism of mental health that can be demoralising and counterproductive. Now, there's no doubt that too many children and young people are not thriving mentally and emotionally in the UK today, and I would like to have that discussion, but I don't necessarily think well-being and mental illness is the way, or mental health is the way to do it. I definitely think the schools are not the place to solve it. So just to finish, a lot of the well-being initiatives, a lot of the counselling, a lot of the therapeutic interventions encourage young people to look at life through the subjective filter of their own feelings and anxieties. That, in turn, is likely to lead to inward-looking, self-absorbed children. The role of education in schools is to introduce new generations to the wonders of the millennia of knowledge that's outside of their experience, that takes them outside of themselves. That's what schools are for. That's what teachers are good at. It's not just about gaining credentials. In fact, I hate the credentialising aspect of it. But a brilliant novel, The Law of Physics, The History of Our World, Evolution. If you get into that, you forget your troubles. If you're constantly talking to the counsellor about your troubles and yourself and endlessly thinking of one's own well-being, it's boring, demoralising, stunting, and it's enough to make anybody depressed, including the young. So I think that it's very important the schools don't get completely obsessed with this issue. I fear they have, and it's made matters worse.